my name is Allison.
Hi, my name is Alec.
Hi, my name's Belle.
And I am Zach.
And today we're presenting on advances of technology in nursing. Technology in nursing has come a long way from doing everything by hand.
In this video, we want to introduce the different types of technology being used, examine new technology in the nursing field, and discuss the challenges with implementing new technology.
According to the Nursing and Implementation of Modern Technology, there are 6 different categories of technology that are changing the nursing field. Some of these categories include 3D printings, genetics, and robotics.
3D printing capabilities can create layers of cells, tissues, and eventually replicate an entire organ. Not too much is known about the limits of what we could 3D print, but with the right materials, we should be able to print organs more easily and affordably.
In the genetics and genomics field, we are able to look at genetically linked diseases more easily than ever before. With this technology, we can better understand how genetic diseases work and how to best treat them. Robots can be used for better diagnostic readings and precise decision making. However, there is still being research done on whether or not robots are as effective as human nursing care.
In an article called 7 Nursing Technologies Transforming Patient Care, 7 different technologies or devices are discussed. Some of these technologies include automated IV pumps, wearable devices, and electronic health records.
Automated IV pumps are super cool because they allow nurses to work with computers to change types and concentration of medication automatically. They also make care more efficient by decreasing the number of human mistakes.
Wearable devices can be used to track a patient's heart rate, exercise, sleep, and much more. Just think of your average smartwatch with the ability to take in massive quantities of data. This data could be easily sent to nurses or other medical professionals to get an accurate and constant feed of information to make sure a patient is doing all right.
Electronic health records may sound mundane, but they're actually doing a world of good in the nursing field. Medical records used to be all done with pen and paper. Being able to store medical records electronically makes it easier for nurses to find old information and add new information to someone else's medical record.
Some challenges that come with integrating new technology into the nursing field include balancing the technological aspects with the human aspects, balancing the costs and benefits, and training nurses to use the technology.
In terms of balancing the technology with the human side of nursing, nurses have to find the Goldilocks zone where they can use the nursing technology to treat patients.
If you use too much of the technology, the care could be incredibly efficient, but lacking in the social interaction required to make a patient feel comfortable. But on the other side of the coin, the patient could suffer from inefficient care if there is too much human care and not enough technology.
In the end, it is up to medical providers and nurses to determine the sweet spot between the two.
Balancing the costs and benefits is another thing to consider when deciding what and how much technology one wants to incorporate into patient care.
On one hand, the technology is pretty expensive, but if a hospital uses it to help more patients, the hospital will be able to treat more patients in the long run. Once again, hospitals need to find a happy middle ground to determine whether they can afford new technology in the long haul.
The third factor people need to consider when implementing new technology is the ability to train nurses to use the new technology. Let's pretend that at Y Hospital we have a new device introduced to the medical staff. The problem here is that no one knows how to use the technology, so someone has to teach every single medical worker in that hospital to use this new device.
And if it's a difficult device to use, then it will take more training for everyone to master the usage of this new device. So, hospitals need to figure out how they want to go about training their staff before they start using the new technology.
As you can see, the medical field has grown significantly in regards to technology, and in the different categories of medical technology, there's still so much to discover. Looking down the corridor of time, we can expect to see some revolutionary technological advances ahead of us.
And hopefully, over time, we will be able to create the most effective patient care to best help patients.